is Mr. Kona. The task is this is Mr. Kona. He was brought into the accident emergency. He was found unconscious. Primary survey, secondary survey has been done. Primary survey, secondary survey has been done. I'm the senior house officer. My task is to do GCS and relevant neurological examination. That is my task. Right. Hello, examiner. This is my reference number. Can I please proceed?
Yes.
Thank you very much. Thank you. First of all, I'd like to take all universal precautions before I approach my patient. I'll expose my patient from head to toe in order to do a head to toe examination. I'll maintain my patient's dignity, maintain his privacy, and also request for a chaperone. Can I please have a GCS card? It's on the
yes,
board.
sir.
Thank you. Thank you. Hello, Mr. Kona. Mr. Kona, I'm Dr. Ashar. I'm one of the doctors here. Mr. Kona. Mr. Kona, I'm here to examine you. Mr. Kona, can you please try and raise one of your hands for me? Mr. Kona, can you try and raise one of your legs for me, please? Mr. Kona, can you please try and stick your tongue out? Mr. Kona, I'm not your daddy. Mr. Kona, can you please try and blink your eyes twice? Mr. Kona, do you know where you are? My patient GCS is 7. My patient GCS is 7. I'll immediately call an anesthetist for intubation. I'll immediately call an anesthetist for intubation. On inspection, I cannot appreciate any signs of trauma, any laceration, any bruises to the head. Cannot appreciate any signs of trauma to the forehead. There's no battle sign. Cannot appreciate any raccoon's eyes. Cannot appreciate any discharge, any bleeding from the ears. Cannot appreciate any discharge, bleeding of foreign body in the nose. Cannot appreciate any smell of alcohol or any acetone breath. Cannot appreciate any strangulation marks on the neck. Cannot appreciate any puncture marks in the cubital fossa. Cannot appreciate any diabetic asthma or epilepsy bracelets. The chest is moving bilaterally symmetrical with respiration. Cannot appreciate any signs of trauma to the chest or the abdomen. There are no signs of trauma to the lower limbs. There is no deformity of the lower limbs. No signs of external injury to the lower limbs. Right. Ideally, I'll examine the muscle bulk with the help of a measuring tape, but on gross inspection, the muscle bulk appears to be normal. There appears to be no muscle wasting. Tone is increased in the right upper and the lower limbs. I'll examine my patient's plantar reflexes using an orange stick, and I'd also like to check the pupillary light reflexes. The ankle jerks are normal bilaterally. Knee jerks are normal bilaterally. I'll finish my examination by examining the reflex in the upper limbs as well. When I'm done, I'll cover my patient up. Thank you very much. That's all. That will finish your station.